Hello everyone and welcome to another episode of Ask Dr. Bob. Dr. Bob, do you have any recommendations for SIBO, which is small intestinal bacterial overgrowth? It's a very good question, the very first time that we had that. First, I'd be concerned about how many antibiotics that you've used over time. There is a blood test called a chem profile. We like to look at a person's CO2, carbon dioxide. If it tends to be on the low side, you may need some L-glutamine. That's how we would approach that. Also depends if you have a cat or eat sushi. You may have some parasite infestation. You may consider a probiotic. You may also consider a stool culture to find out exactly what organisms may be proliferating. Dr. Bob, what's your opinion of algae? And you wrote the word kelp as a natural iodine provider. If it comes from an organic source, I'm really having some issues today with kelp that's coming from the ocean. I have nothing against kelp, but kelp itself is absorbing all the toxins and the nutrients from the ocean and toxicity. So we actually use an iodine, I use an iodine pill every day from Biotics Research Corporation. Dr. Bob, I eat a pretty clean diet. In the last 8 months when I consume sea salt, fish, and shellfish, I instantly get blotchy spots, like I'm allergic, and eventually eczema on my hand. And I've also have to be careful with spices. Black pepper sets off my hands instantly. But you have issues with cinnamon, turmeric, cumin, causes your body to react. You know, this is a possibility, is molybdenum. Molybdenum might be something you're deficient in. We use a product called Mozyme. We usually see issues with that individuals that have a molybdenum deficiency. You mentioned something that you have problems with ginger and lavender shampoo. There's a tremendous book that I've mentioned in the past called The Ultimate Healing System by Dr. Donald Laporte. In it, he has antidotes for different nutrients. I was just having a conversation with somebody who has a pineapple sensitivity, which there are nutrients that you're deficient in that allow those different fruits that are not bad necessarily to create distress. Dr. Bob, I'm disappointed with myself for not knowing you earlier. You wanted to know something about mental illness disorders and severely mentally ill. Here's a thought. We're seeing more and more people today that have subpar thyroid, and one of the leading causes of depression is subpar thyroid, L-tyrosine need. But I also wrote a book on ADHD about 15 years ago, and I learned along the way that fats, long-chain fatty acid called DHA, can commonly be low. So that's one of the reasons that we do an essential fatty acid blood spot test. That is where I would start, and I may encourage you to get my book, Dr. Bob's Guide to Stop ADHD in 18 Days. Dr. Bob, how do I increase the phosphorus in my diet? Well, let me put it to you like this. We have noticed more using a pulsometer and oxygen levels being like 96 or lower, that usually means that someone might be consuming alkaline water, which upsets normal digestion in the stomach. I know a lot of people drink alkaline water, and I might get some hate email because of this, but alkaline water confuses the body. And we have noticed that the antidote for that is phosphorus, and we use a product that's a phosphorus caps. You don't want to just take phosphorus liquid because you could really throw your system off. Get a pulsometer. Pulsometer is going to help, or oximeter. It's going to help determine your oxygen levels. If it's less than 95, 96, please contact us. Dr. Bob, I've been told by my doctor, my eye doctor, I have pressure in my eyes, and you want to know how to take care of it because you're 38 years old, and you also mentioned something that their eyes feel dry at times. Well, we use something called carbamide, which gets rid of the extra fluid inside of the body, and I've also learned over time that dry eyes can be caused by lack of iodine. So these are some very unique, very first-time questions. We appreciate it. Please pass this information on. I'm Dr. Bob DiMaria.